Researchers at Albert Einstein College of Medicine and Montefiore Health System have received a 4-year grant to study how neighborhood development affects cardiovascular disease among older Black and Hispanic residents in the Bronx. And joining us now to tell us more details is the Director of Department and Family Social Medicine Research Division, Earle C. Chambers. And Earle, I'll start off by giving a little disclaimer. I said neighborhood development, it's really neighborhood redevelopment. And thank you for joining us. And I guess the operative question is, when you talk about neighborhood redevelopment, cardiovascular health, make the connection for us, because somebody's saying, okay, how do the two intersect?
Right, sure. I mean, I think, if you think about neighborhood and neighborhood access, right? So redevelopment is what happens when there is an investment in communities and it changes your access to resources. So it can redevelop in ways that increases the amount of housing. It could add additional resources to eat healthy, to exercise, to have access to healthcare. So when we talk about redevelopment and heart health, there are a number of health behaviors that we think about for healthy heart. Trying to quit smoking, increasing your exercise, a better health, more sleep. So all of those things can be affected by the access to the resources in your neighborhood. So when redevelopment happens, you're able to access these kinds of things like exercising or eating more healthily as new stores come about or more investment happens in parks, and you're able to have a better chance at increasing your heart health by engaging in these different healthy activities.
So you got there's a 4-year study, and there's going to be this survey that goes out to study. Give us a little bit about how this is going to play out.
So what we're intending to do is we're going to look at a neighborhood that's undergoing a redevelopment currently, and we're going to look at our patients that live in those areas. So we're going to look at different health outcomes, looking at their weight, their height, different heart health outcomes like heart attacks and stroke and those kinds of things. And we're also gonna survey them. So we're gonna ask a lot of questions about their health patterns, their health behaviors, and make a connection between that and the neighborhoods as it's changing over time. And ask them about questions about how they're accessing these resources. So, for example, sometimes when neighborhoods change, it doesn't change in ways that is of benefit to all residents. So we want to better understand that. Some of our older residents, they may have difficulty accessing new resources as they come about. So we want to better understand that. So we're going to do surveys, and we're going to also look at their health outcomes as we can get from their clinical record when they come into the hospital system.
When we look at it and all is said and done, what are you hoping to be able to gain and prove through this study?
We want to be able to provide evidence, or at least provide city planners and also advocates that are looking at neighborhoods and how they change for the better or the worse for their residents. And so what we're hoping to do is provide data that is able to show that as neighborhoods change, these are the kinds of resources that our residents can benefit from if they're able to access them. And so basically it's just to provide more evidence in support of how our different neighborhoods, as they redevelop, can be of benefit to the residents that have been living there.
For yourself, to arrive at the place where you're saying, listen, redevelopment, heart health, the fact is there are some people who really are adversely affected, correct?
Yeah, potentially. I mean, we know that for some of our older residents that are if they're able to remain in these neighborhoods as they change, some of these old places that they've been accessing, like certain supermarkets or stores, different access to resources, those things may not be able to remain as the neighborhood changes and things change. So the question is, as these new resources come on, are they able to access them in ways that they were able to before? So are they better able to access these healthy options when these healthy options become available? So that's what we're trying to better understand in our older residents as these neighborhoods change.
For the study, when will people be able to see it? How do people participate in it?
Well, it's just starting now, so we're just at the beginning stages of developing the project. In the next few months or so, we'll start to contact potential patients and start surveying people. So just be on the lookout for if you live in sort of these redevelopment areas and you get a call from us about the study, then we're hoping that you will consider participating.
For yourself, I know it's been a very, you're intense in this because this is a part of what you want to see happen. You want to know. how do you think the community will benefit after all is said and done?
Well, I think what we're trying to show is that there are ways for us to be able to redevelop neighborhoods that are of benefit to the residents that have been living there for years. And so, one of the big concerns when redevelopment happens is that people are displaced, right? They're no longer able to remain in these neighborhoods as these neighborhoods get quote unquote better. So, what we're trying to show is that with careful redevelopment, we can also make sure there's resources that are available for the people that have been living there and really been advocating for these changes for years.
Have you seen the study done in other places across the country?
There have been studies, many different kinds of studies that have looked at these issues of what happens in redevelopment happens in different kinds of health outcomes. The one that we're doing now is comprehensive in that we're looking at a lot of different kinds of changes. So the redevelopment is increasing the amount of housing and affordable housing. It's also increasing the access to different kinds of food options and stores that are available in these areas. There is an investment in the parks in these areas, so for them to become more accessible. It is a full-on kind of redevelopment effort, and we're trying to capture all of that, and most importantly, trying to look at how it affects the heart health of our residents that we serve in these places that are starting to redevelop.
Yeah. So, if people want more information, how do they go about finding out?
Well, as I said, we're just starting to study now. I'm very easy to reach. I'm available. I'm at the Albert Einstein College of Medicine and Montefiore Health System, and anybody can sort of reach out to me if they have any questions or want to learn more about the study. But in the coming months, as we start to develop our project and things can start getting moving, then you'll be hearing more and more about it.
As you've done the work so far, just to get to this point, is there anything that stuck out in particular for you as a major point that say, aha moment, if you will?
Yeah, I mean, so for the whole sort of beginnings of this idea to look at heart health as it relates to redevelopment is really just born out of community efforts to really take control of these redevelopments and advocate for the health interest of the people that live in these areas. So this is an extension in my mind of just ongoing work that communities have been doing for a while now to try and really better able to access these new resources when they come online. So
Yeah. Well, Earle Chambers, want to thank you so much for being with us, and we're going to be looking out to hear how the study turns out and the connection between neighborhood redevelopment and cardiovascular health. So thanks a lot.
I appreciate your time. Thank you.
All righty. Well, listen, now, if you want more information, don't hesitate to visit the website, einsteinmed.edu. Also, follow them on Instagram and Twitter at EinsteinMed. We encourage you don't go anywhere. We'll be back. We got more Open coming up right after this.